Welcome back, everyone. What would you do if you found out you had an 80 or greater % chance of developing a deadly disease? How far would you go to try and prevent it from happening? Those were the questions a local mom and daughter had to answer at the exact same time after a cancer diagnosis and a family member revealed they too were at high risk. I recently sat down with these women to find out what led them to make a decision that will bond them and change them forever.
You know, there's always the chance you might get cancer.
When Sandy Sheely and her daughter Tiffany Manker found out last year that Tiffany's younger sister Jennifer had stage 2 breast cancer, they were stunned. And how big of a shock was that to your family?
Big.
Jen's cancer was discovered by her husband as a lump on the 4th of July, and it was aggressive.
The 14th, they did a biopsy. The 17th, they found out it was cancer, breast cancer. And by the 29th of July, she had the double mastectomy.
Jen's treatment also aggressive, and genetic testing eventually revealed the cancer was caused by a mutation in her BRCA1 gene, passed to her by either her mother or her father. Turns out it was her mom, Sandy, who tested positive for the gene mutation, as did Tiffany.
And it affects women, their ovaries, breast tissue. I mean, it affects all parts of a woman.
And it does so in a very serious way.
The BRCA1 patients have a markedly increased risk of breast cancer and to some degree ovarian cancer.
The women's general surgeon, Dr. James Wolfe, says for the average non-high-risk woman, the chance of developing breast cancer is about 12%. For Tiffany and Sandy,
it was 80 to 90%.
The choices were to accept the genetic test results, meet often with their doctor, and deal with the cancer down the road if or when it developed. Or they could be proactive and choose to fully remove both of their breasts, a procedure called a prophylactic bilateral mastectomy.
Prophylactic mastectomy is the most effective means of risk reduction for breast cancer, but it doesn't completely abolish the risk.
It does have a pretty dramatic effect, though. After a bilateral mastectomy, that 80% chance of getting breast cancer plummets.
10%
or less, yeah.
The huge drop in risk is what made the procedure almost a no-brainer for this mother and daughter.
Knowing that we wanted to be there for our family and seeing what my sister had gone through, there's no way I want to put my family through that or myself through the things that she went through.
So within weeks of each other, they each spent 8 hours in surgery having their breasts removed. And another affirmation for Sandy in particular was what they found during her surgery that mammograms and MRIs hadn't.
They found out that I did have some clusters of cancer cells in one of my breasts. And I don't know how soon that would have done anything. I don't know what would have happened, but they were there.
The choice is a difficult one, though, for most women with the BRCA1 mutation, considering there is a chance they may never develop cancer. Physically, losing both breasts in one fell swoop is tough for women who feel that's a big part of their identity as a woman. And it's an especially hard choice for women who haven't yet had children but want to.
Because some of these gene mutations also have to do with ovarian cancer, there's some very real decisions that have to be made with childbearing.
Plus, breastfeeding no longer an option after a double mastectomy, and for women like Tiffany and Sandy who do breast reconstruction afterward, the downtime can be quite long.
So it's going to be a good year that we have not been able to really physically do things.
But what Sandy and Tiffany have done is become closer to one another through an experience they never expected to have.
We share a lot, and sometimes real personal things we share, and maybe we shouldn't be sharing, but we're able to because we've gone through the exact same things.
But an experience they've never regretted, not even for a second.
Especially after watching, her sister go through all of that. What we did was so minor, I felt.
My plan is to live to 100, like a couple of my great-grandmas, and I know that, okay, what's the next step?
Rachel Garceau, Good Morning, Idaho. And the next step is that Sandy and Tiffany are both now working with a plastic surgeon to have their breasts reconstructed. That process will take nearly a year. And one last note about the BRCA1 gene mutation. It is carried by and can be passed on by women and men. So Tiffany is planning to have both of her sons screened for the mutation when they get a bit older.